Angina is pain or discomfort in your chest. It often feels like heaviness, tightness, or a dull ache and may spread to your arms, neck, jaw, back, or stomach. Symptoms vary from person to person. Angina is usually caused by a buildup of fatty deposits inside the arteries that supply your heart muscles with oxygen-rich blood. The fatty deposits can make these arteries so narrow that your heart muscles doesn't get enough blood. This can cause pain and discomfort. There are different types of angina. Stable angina may be brought on by triggers such as exercise, eating a large meal, feeling anxious, and cold weather. Stable angina usually improves after a few minutes. Rest and medication should help too. Unstable angina is more unpredictable. There may not be an obvious trigger for attacks. Medication might not help. An angina attack doesn't permanently damage your heart muscle, and having angina doesn't mean you will have a heart attack, but it does increase your risk, especially if you have unstable angina. How can one manage its angina? Your doctor may prescribe nitrates. Nitrates relax your blood vessels, allowing more oxygen-rich blood to reach your heart muscle. Short-acting nitrates such as GTN come as a tablet that you put under your tongue or as a spray that you use them when you feel angina attack coming on or before you do something that causes angina. Long-acting nitrates come as pills or patches. You use these every day to prevent attacks. Nitrates can cause side effects such as headaches, dizziness, but this usually doesn't last long if you use nitrates regularly. You can build up tolerance so they don't work as well. Other medications such as beta blockers can also help prevent angina. If you have stable angina but your attacks begin to happen without obvious triggers or you experience pain at rest, speak to your doctor immediately.